Okay, let's, look at this. You can see, look at this. Suspensory ligament of the ovary. See how it suspends the ovary in almost mid-air? It's magical. It's colored in red. Suspensory ligament. Now you'll notice we don't see a whole lot of detail of the actual uterus itself, and that's because it's covered over by the broad ligament. Now remember we said that this entire structure here is the broad ligament. Broad ligament. Okay, so it's covering over all of that. So it's covering over the actual fallopian tube, the ovary, and the uterus itself. But we also said that if we were to have a specific tag just right there, we'd call that the mesometrium. And then we said if we had one over here by where the fallopian tube is, and it were to say name this layer of fascia, we would call that the mesosalpinx. Sal, S-A-L-P-I-N-X. Okay, so remember, I'm not going to be looking for just broad ligament. I guess I could, if it just said number 16 and that's what was tagged, you could probably get away with broad ligament, but I don't think I'll do that. It'll say name the specific layer or the specific area of fascia. Everybody okay with that? Remember, you also have that mesoovarium. And we said that the majority of the time you'll see a picture of sort of the fallopian tube like this. You'll see the ovary just kind of in front of it. And then you'll see like this area between is where we see the mesoovarium. But we're not really going to see that. Okay? So that won't be on your test because I can't really tag it. All right. So let's go ahead and let's cut this guy in half. Lady in half, excuse me. And let's look at the actual uterus itself. Now, at the very tip of the uterus, we can see the fundus. And make sure fundus of
The uterus.
Okay, this is the body of the uterus itself. I typically would tag it though like a little more on the outside. So essentially where that broad ligament was, if I put it through there and I didn't say anything else, you could say body of the uterus, you could say broad ligament, or you could say mesometrium. Any of those would be acceptable. Now here, what you're seeing is the vaginal canal right here. That's the vaginal canal. And it's leading you to the actual cervix, which would be like right here. Okay, so this point right through there is where we see the cervix. I don't really love using the Anatomage table for that because you don't clearly see the tissue opening or where the potential space would be. It's normally closed off, but you don't see that there. So again, I like using the models for that, but that is where it would be located on the actual cadaver itself. And let's see if we can maybe change what it looks like a little bit. See a uterine fibroid there. See that in red?
With the fibroid?
Yeah, that uterine fibroid is like a hardened nodular tissue. Now you can see right through there, actually, you can see the cervix a little bit better. I don't know if you can see that, but if I turn it that way, do you see how you see that impression where it's kind of opening? That's the cervix itself. All right. Now remember, there's 3 different layers, right? So if we pull this up, we have this outer layer where we would have the blood vessels here. Remember, that's surrounding the uterus, just like periosteum surrounds a bone. The perimetrium surrounds the uterus. The next layer that we said was a little bit thicker here. This next layer that's a little bit thicker. Remember, that is the myometrium, so it's the muscular thickened middle layer. And then the very center of it, right there where you can see it's kind of opening, that's where the endometrium would be. Now again, we don't see it as well as I'd like to see it, but you can see it's right there, that inner lining. I will say if I tag that, I typically use that model, the one where we could like open it up and we can see like the separate layers, and you saw the blood vessels, you saw the myometrium, and then you saw the inner kind of columnar cells. And that's typically the one I'll use for that.
If you add more to the model, can you see different parts of it better, or is that as good as we can see it on the
It's probably going to be about as good as we can see it, but let's take a look and let's see what we can see. There we can see the inner layer a little better. So we can see that endometrium a little better. You can see the thicker myometrium a little better. And then of course the perimetrium as well. So remember, the ovary is also attached via a ligament. So if I tag this right through there, we see an artery. Let's see if I can get it. There we go. Our ovarian ligament. Let's see. Put it in green there, and we'll tag it. So we can see that ovarian ligament. So the big key for knowing the ovarian ligament is, number one, it attaches to the ovary, and then it goes to the actual body of the uterus. Now the fallopian tube is not going to do that, right? The fallopian tube is going to make a little bit of a different shape. Let's get rid of the cardiovascular portion, kind of clouding what we're looking at. Now as we look through here, I'm going to get rid of the bones too and see if we can see the fimbriae any better. We don't see it too much better. You can sort of make out like that little roughened edge here at the very tip. So the very tip here, that would be the fimbriae. Remember we said the next part on the tube itself is the infundibulum, okay? And then we said like as it turns, so as it turns like right here, that area right through there. Yeah, that's right, the ampulla. Perfect. That right through there. And then we said the last part was the isthmus. So remember there's 4 parts to that fallopian tube. We'll be looking for the specific part that I tag. Fimbriae would be at the very tip. That's how you know I'm looking for fimbriae versus infundibulum, because there's a very small area where the tissue change is actually happening. So fimbriae will be like the fingers or finger-like projections, so you won't miss that, it'll be on the tip. The infundibulum will actually be on the tissue just above the fimbriae. The ampulla, where I tag that, will be right on this corner. Like, I don't even love that tag. Like right here where you see the curve, that's where I would put it. And then the isthmus, that should be simple because it'll have the rest of it. Just make sure you follow where it's going to, because you can also see the round ligament of the uterus is here. You can also see the ovarian ligament is kind of close as well. So you could get confused if you don't trace it out and just see where it's going. And remember on test day, you can do this, right? And then if you get confused about what you're looking at, just use this guy right through here and hit that, and it'll put it back in the center for you, okay? That cecum looks a little lonely, right? It's like, what is it doing there? That was a good appendix, so it's a pretty good appendix. I like that. Anterior lateral surface of the uterus, we see the round ligament of the uterus. We talked about that yesterday. Let's highlight it. Let's use a different color than red though. Use a little baby blue. All right, so round ligament of the uterus. And then we said at the posterior aspect, we had another thing wrapping around the rectum and going to the sacrum. I have the sacrum back in just a second. All right, why do I keep going for that red? This was that yellow. So the sacrum, let's add the sacrum back on just so that we can see how that attaches, right? So here we can see where the actual uterosacral ligament is attaching to the sacrum itself. Remember, the round ligament of the uterus is passing through the actual canal. So it's going through the inguinal canal. And the last thing that we need to see inside the pelvis is going to be the bladder. Now the bladder is right here, all right? And if we go ahead and we cut in half again, oh, we already did that. That's why it's not doing anything. Let's turn it to the side. Now, inside the bladder is going to be the detrusor muscle. So if there's a pin like right in the center, I'm not looking for bladder, I'm looking for detrusor muscle. Yep. The urethra is right here. And then surrounding the urethra, let's see if we can get it. Let's see if we can get that sphincter muscle. So again, it's wrapping around the actual urethra itself to constrict the flow of urine so it doesn't just come out whenever it wants to. So sphincter urethra, wrapping around the urethra. The urethra itself is the opening from the bladder, okay? And then here, the detrusor muscle. And I guess we could add the ureters in there as well too. Why don't we just do that? And then we're gonna look at the urogenital triangle. Now on test day, we can see the ureter here, but on test day, I probably would go ahead and add the kidney in there too, so that there's no confusion about what it is. Oh, it's a pelvic. Oh, it's a pelvis, that's fine. Yeah, so again, on test day, kidney bean, okay? Doesn't look anything like a kidney. I don't know what that looks like, a thought bubble. Okay, any questions about the stuff inside the pelvis? Let's take a look at the stuff underneath the pelvis. Okay. So rectum, vagina, the space in between the two, we're gonna see the perineal body. In order to do that, we need to get rid of the labia majora, labia minora, and then we come to this bit of tissue. So right through there is the perineal body. Remember that that is the tissue in between the inferior aspect of the vagina, but anterior to the rectum, okay? So that's the tissue, that's what it looks like through there. Going right across, we can see these transverse perineal muscles that make up sort of the inferior part of that triangle. So if we tag it, we're gonna see the superficial transverse perineal muscle, but you'll recall that that's not on your list, right? So if we get rid of that, and we get rid of that, and we go one layer deep, now we come to the deep transverse perineal muscles. Let's do that in that color. You can see it right through there. Deep transverse perineal muscle. So in here, we can see the last structure we're concerned with, which is the greater vestibular gland. Also known as Bartholin's gland. Don't let this line confuse you, okay? Remember that's going deep to the sphincter urethra, which is in green. This is coming here to this little tissue right there, and that's Bartholin's gland. Above it is, doesn't really matter, but it's the bulb of the vestibule. It's not on your list, so we're not too worried about it. And then that's it. Anything on your list that I didn't say?
Number 1 is the perineal body.
Got it.
Number 2 is the great vestibular gland.
Mm-hmm.
Number 3 is the deep transverse perineal muscle. Number 4 is the sphincter urethrae muscle. Number 5 is the urinary bladder. Number 6 is the ureter. Number 7 is the urethra.
Anatomical, go ahead. Number 1.
The fundus, I gotta go here. Number 2 will be the body.
Let's get the 1 going, good.
Number 3 would be
2, good.
cervix.
Let's get 3.
Number
Give me a broad.
Is the uterine 2.
Wait, you still got all those.
3, good. Four is fimbriae. 5 is,
the infundibula.
yes, perfect.
6
Get it going where it's nice and good.
is the ampulla.
Oh, it's actually in the wrong. It's okay, just, I can make it work.
Here.
From right there,
Yeah.
it's the ampulla. Boom, got it?
And number 8, or number 7 is the isthmus.
Isthmus, got it. 7.
Yeah.
And 8.
8 is
Yep.
the perimetrium.
So we can get all 3 of those at once. 8,
9
perimetrium. Go ahead.
is the myometrium.
Uh-huh.
And 10 is the endometrium.
10 is endo, got it. Number 4,
Is the mesometrium.
mesometrium. Number 3,
Is the mesosalpinx.
mesosalpinx. Number 2,
Is the
round ligament.
round ligament, aka the ligamentum teres uteri.
Okay. There's a
And
good one.
Number 1 is the ovary with the tunica albuginea.
Perfect. Number 1 is
The ovarian ligament,
ovarian ligament. Number 2
the
is,
suspensory ligament of the ovary,
and 3,
the uterosacral ligament.
Boom.